Hi, I'm Robin Raskin here at Digital Health Summit Live, and this is a pretty fascinating conversation. I joke that technology probably causes mental health problems, but today we're going to talk to ARSHYA, who is on the faculty at Harvard Medical School, who is a director at BrainPower, and he's going to talk about how, in fact, technology can help us solve some of the mental health problems that we're seeing. So, ARSHYA, why don't you tell us a little bit about the landscape of mental health and technology's role?
Thank you very much, Robin. I think that mental health technology is an area that is rapidly expanding. There are over 200 startups and companies focusing on mental health, and there is increasing investment in this area. That's across a variety of different domains, from provider platforms, telehealth, big data analytics, and now we're also seeing an emergence of neurotechnologies and augmented and virtual reality technologies. So there's enormous demand, there's now a lot of interest, but there's still a variety of key questions that need to be answered. Some of those questions include, what is the product that people are producing? Does it work? And who does it work for? And that raises a variety of questions in terms of the clinical evidence that is needed to support the ideas or claims that some of the companies are making.
Right, so give me a couple of examples. What are you seeing in the mental health field using technology that excites you personally?
So personally, I'm very much involved in BrainPower. I'm a director of BrainPower, which is a mental health company that's using both big data and analytics, but combined with augmented reality interfaces to help people learn important social and cognitive skills. Our first product, the BrainPower system, helps children with autism teach themselves these important skills while they're interacting with their family members. But we're involved in lots of other projects, and across the landscape, we're seeing increasing interest in people looking at anxiety, at depression, at phobias, at trauma, for example. So it's a very hot space, and
Right.
I think that there's a lot of opportunity here.
And the big data part, are you looking at like where these instances occur, for example, inner city, or is that a part of what you're doing?
Absolutely. I think the big data part allows us to collect this huge data set, and from that untangle and decipher what areas are difficult for particular children or particular subgroups. What I mean by that is when we say autism or when we say depression, one of the things we know is that these are actually a spectrum of conditions. So depression can actually be diagnosed based on 126 different sets of symptoms, and autism is a spectrum. So how do we use this data to subdivide these conditions into more clear subtypes? How do we understand when a child is going to get upset and have a behavioral episode? And what are the sensory aspects? What are the GPS coordinates? What are the social factors around them? And I think big data will help us to elucidate that for a population, a subpopulation, and also individually for a specific child.
So it's a combination of self-reporting incidents as well as biometric feedback, is that?
Yeah, I think self-reporting has always been important in mental health. But now with the wearable technologies, with passive data collection, whether we use smartphones or in our case, we use a lot of smart glasses that are really loaded with lots of different sensors, built-in sensors that can just actively collect data, such as head movements, for example, nodding, visual, audio. And all this data is so rich, but we need to be able to process that and have the analytics to actually look at that closely to get insights that will lead to actionable steps for families.
That's pretty incredible. And I guess I have to ask you the payment question. So all of this is available. Is somebody going to pick up the cost of a family exploring mental health and tech?
So your question is key. So when I started, I said, a fundamental question is, what is your product? Is it going to work? And the other key question, who is going to pay for it? So we're seeing that some companies are aiming for consumers, some companies are aiming for businesses, for occupational services, and I think it's still to be kind of sorted out exactly who is going to step up and pay for these different technologies. One thing we know is that they're very much needed, and when we think about mental health, when we think about behavioral health, these conditions are driving healthcare costs across all of the medical conditions. So it really spans across the whole range.
Right.
So with insurers, with state organizations, with private entities, we all have to kind of figure out mechanisms to make these technologies accessible to the population.
I love that you're doing this and tackling one of the least known and least discovered areas. So to find out more, we're going to send people to brainpower.com to find out more about the company.
That's right, brain-power.com.
Brain-power.com. Asher, thank you so much for being with us live from the Digital Health Summit. Robin Raskin.